Hi, I'm Ivy Elkins, and I'm a lung cancer patient and advocate, and I am here with Hope with Answers in the U.S. today, but I'm talking to Dr. Natasha Leighl, who practices in Canada. So I thought we would talk a little bit about the differences between the treatment of lung cancer patients in the U.S. versus Canada. Could you tell me a little bit about how patients are treated differently?
Sure thing, Ivy, and please call me Natasha.
Great.
So some things are very similar. So access to radiation treatments and surgery, I would say, are very similar. In Canada, we have a public healthcare system where everyone can access tests and different treatments like surgery and radiation and chemotherapy treatments across the board, and it's covered by what we call our universal public healthcare system. Where the differences, I think, start to emerge are things like biomarker testing for targeted therapy, and then also sometimes access for targeted therapy. And so it can really be hard, I think, in Canada. I think people worry so much about what are the differences between what I'm getting in Canada and how would I be treated differently in the US, and does it make a difference? And so I think it's really, really important to have a great relationship with your doctor so that your doctor and the whole team is very open with you, and so that you really know that what you're getting is the best possible therapy. And when there are options that we think are important in the US that we can't get for you in Canada, that your doctor advocates with you and strategizes with you to get you the best possible treatment that you need.
Now, what about patients who are in Canada? Can they access trials in the US if there's a really good trial that they're interested in?
Yes, and so sometimes we do send patients to the US for trials. Usually what we'll do is, once we've talked about it, we do look locally and throughout Canada to make sure that there's not an easier, cheaper option. But all often, if my patients have to go to the US for a trial, we'll figure out some way to make things a little bit more manageable. Can I do the scans at home? What can we do at home that's covered so that you don't have to pay for it in the US? I will say that there are also a lot of other options. So very often your doctor can look into special access programs. We can set up special programs, and sometimes, if you look around, there are different websites, and your doctor can also help you look. There might just be a clinical trial in Canada, and sometimes you can even shift provinces if you have to get some of these opportunities a little more easily.
Great. Thank you so much, Natasha, for sharing all this information with us. We really enjoyed having you be part of Hope with Answers.
Thank you so much, Ivy.